Greetings. Today we are going to be talking about RTI, MTSS, and the special education referral process. Here is an overview of what we're going to be talking about. We're going to be talking about identifying the struggling students. We're going to talk about IQ achievement discrepancy, RTI and MTSS, and special education referral process. As educators, most of us can identify students who have learning and behavioral problems within our classrooms. These students are noticeable because they draw attention or would like to draw attention from other people around them. And they do this because they have a hard time with the task that they are given, or they're just not really sure how to interact with others around them, whether that be peers or adults. These students may struggle academically. They might have attention issues, hyperactivity, memory issues, poor language abilities, or they may even express aggressive, withdrawn, or kind of bizarre behaviors. About 15 to 25% of a school's population has some kind of learning problem or behavior issues within the classroom. And then less than 6% end up receiving special education services. So a big question that we have then is, how do we determine whether students have learning or behavioral disabilities? We know they're having problems, but do they have a disability that's impacting them within the classroom? One of the models that has been used in the past and we're going away from is the IQ achievement discrepancy model. Within this model, students are referred by teachers and families. Students complete IQ assessments and achievement tests. And then it's our job as a school staff to decide, or as a team to decide, is there a large enough discrepancy between the two, between the IQ and the achievement tests? There are some issues with this. We have to decide whether, is this appropriate? There's been some research done that shows it may not be appropriate for minority students, and it may not be appropriate with young children. Many of us have heard the phrase wait to fail come up often. And that's exactly what it sounds like when we have and when we use this discrepancy model between IQ and achievement tests. In younger students, sometimes it's harder to see that discrepancy. When they're younger, the discrepancy might not be as large. And so we might decide, this discrepancy isn't big enough. We're going to give it time. We're going to wait just a little bit longer. And we wait until that student, of course, fails. They don't end up making adequate progress, and that gap gets bigger and bigger. And we've wasted a lot of time. There is no prevention program with the IQ discrepancy model, which our students can benefit from while they're waiting. It's also very expensive. The IQ assessments and achievement tests cost a lot of money, and they also take a lot of time to give. And then we also receive little information from these assessments for our teachers to help support these students as they move on. They either have a large enough discrepancy where they do qualify and receive special education services, or the discrepancy is not large enough and they don't receive services, and then they are just back in the general education classroom. So the big question that we have is, how do we reach all of our struggling students? Not just the ones who have this huge discrepancy right away, but how do we reach all of them? And the model that we like, the preventative program, the one that I prefer, is the RTI MTSS model because of its preventative approach and other reasons. What is RTI and MTSS? RTI specifically stands for response to intervention. MTSS stands for a multi-tiered system of supports, which is a framework for all levels of education. RTI and MTSS are used interchangeably. Their foundation, they mean the same thing. They have the same core pieces. There are different states that will call this program RTI, and then you go to a different state and they call it MTSS, but really they are the same foundational thing. They are a model that supports all learners from general education on. And like I had said before, they use a preventative approach. Students are frequently monitored and assessed to determine whether they are making progress with high quality instruction. So it's used to help eliminate poor instruction as the reason why students are struggling. And then a big one is that we use data-based decision making and problem solving. We take the data that we get through the progress monitoring and assessments, and we problem solve. We figure out, okay, here's the data we have. What do we need to do next? And universal screening and placement is in all 3 tiers or levels. There are 3 tiers or levels within RTI and MTSS. Some issues with RTI and MTSS. One is we need to make sure that we are adequately preparing our personnel, which could be a lot of individuals with 3 different tiers. We have to decide who provides the academic and behavioral interventions. Tier 1, which we'll talk about later a little more, is going to be your general education teachers, but especially when we jump into Tier 2, who is going to provide those small group services? Tier 3, who's going to provide the one-on-one intensive individualized interventions? And then as a school, you have to decide what is progress. We want our students to make progress. We throw around that term, but what type of progress are we looking for? How much progress are we looking for? What do we feel is adequate? Do we have the resources to provide the services? Schools have different budgets. They have so many students, so many available staff, and it all costs money. So do we have enough money to provide the services that RTI and MTS need to be done with fidelity? And is there extensive research for the high quality instruction being provided? We see a lot more research on interventions and evidence-based interventions between like K-3, K-4, the lower elementary levels. But when you move past that, there's not as much research for higher levels of students. Our district right now uses the RTI MTSS, so our K-5 teachers are using this model, but once we hit the 6th grade, that's pushed into the high school, we are focusing a little bit more on that IQ discrepancy model. So as I mentioned before, there are 3 tiers with RTI. In Tier 1, we are looking at a general education. This is core instruction for all students. It is high quality instruction. All students are screened periodically, and supplemental instruction is given within the general education classroom. Struggling students are monitored using CBMs for roughly 8 weeks. When we move into Tier 2, this is those students who didn't demonstrate adequate progress after those 8 weeks from Tier 1. And this is roughly about 15% of the school's population will be in this Tier 2. General education with targeted intensive evidence-based interventions. This is small group setting. It's in addition to general education instruction, they're getting both. They're getting the main reading instruction possibly, and then maybe they're moving to small group for more intensive reading intervention. And we continue to monitor progress using CBMs. Remember that data-based decision making. And then lastly, Tier 3, which is roughly about 5% of our student population within our school. This is students who are making little to no progress in Tier 2. It's one-to-one, pull out during general education. It's individualized, intensive intervention that may lead to special education referral. And just a side note that each state can use the model differently. Some states refer to Tier 3 as special education. The referral process. So with RTI and MTSS, students who have received Tier 3 services are still making little to no progress, then a special education evaluation should be conducted. However, note that parents can request a special education evaluation at any time. Whether they have gone through this model or not, they can still request it in writing. the process. So that first step is we have to request the initial evaluation. We have to start it. We need to request it. We need to get parent consent, and we need to conduct the evaluation. We also need to make sure that it's a non-discriminatory evaluation. We need to make sure we have no test bias. We should be making sure that tests are given in students' first language. We then need the comprehensive written evaluation. We take the information we've got from that evaluation, we write it up, and then determine eligibility. Different states have different criteria. Minnesota, if you go on the Department of Education, you'll find state criteria for all 13 disability categories, especially we're mostly talking about SLD and EBD today. And then after we've determined eligibility, if they are eligible, then we write an IEP and we get parent consent. So the two disability categories that we are sort of looking for through that RTI MTS model is the first one is SLD, which is specific learning disabilities. And that's a presumed cognitive processing disorder when other possible explanations below expected are excluded. This could be dyslexia. Student might have developmental aphasia, dyscalculia, and TBI. Those are all diagnoses that could cause a student to have a learning disability. Big one, it is not a result of a cultural, environmental, or economic issue. It's the largest disability category in schools, and it makes up about 4% of the US population. Students who have SLD can generally see about a 30% dropout rate in high school. And we want to use that RTI MTSS to get that preventative approach so we can reach these struggling students sooner, even if and before they have not been recognized with a disability. EBD, emotional behavioral disability, sometimes also called disorders. The Minnesota Department of Education describes criteria for EBD students as demonstrating behavioral consistency by having an established pattern of behavior or responses. So this could be withdrawal, anxiety, depression, problems with mood, feelings of self-worth, disordered thought processes with unusual behavior patterns, atypical communication styles, aggression, hyperactivity, or impulsivity. And again, this is not a result of cultural, environmental, or economic issues. And lastly, just because we don't have a lot of time, here are 3 main resources where this information was from and where you can find more information if you want to dig a little bit deeper on your own. You can Google the Iris Center. It will pop up. It's under Vanderbilt University. And then I encourage you to look at the Minnesota Department of Education, especially within special education. There is a ton of resources and information to just refresh or introduce you to more information on SLD or EBD, or even further into some of the other categories. And then lastly is the textbook Strategies for Teaching Students with Learning and Behavioral Problems, the 10th edition. You can find that on Amazon, Vital Source, many resources. Thank you for your time.